Imagine stepping onto a bustling dairy farm. There's the rhythm of milking, the constant hum of life, and this undeniable drive for productivity.
Mm-hmm.
But beneath that surface, there's often a common, debilitating, and frequently hidden threat. It can have a truly significant economic impact on cattle operations.
Yeah, absolutely.
And this isn't just some simple infection. It's a complex puzzle. Lots of interconnected pieces.
And that intricate puzzle we're diving into today is bovine pyelonephritis. Basically, it's an infectious inflammation of the kidney and its draining system.
Pyelonephritis.
Oh, and remarkably, it's the most frequently diagnosed disease of the urinary system in cattle, especially, within the dairy industry.
Really? The most frequent?
Yeah, it poses a real threat to animal health, welfare, and of course, productivity. Now, while it seems to pop up sporadically, it's actually found worldwide, and it most commonly affects adult cows who've given birth multiple times, what we call multiparous cows, particularly during that critical period right after calving.
Gotcha. So our mission in this deep dive is to really unpack this disease, from its sometimes mysterious causes all the way through to prevention. We want to give you a comprehensive understanding, but, without that feeling of information overload, so you feel genuinely well-informed by the end.
Exactly. We'll be revealing the intricate interplay of factors that make this condition much more than just a straightforward bacterial infection. We're aiming for some real aha moments for you here, kind of connecting dots you might not have seen before.
Okay, let's dig into the basics then. What exactly are we talking about when we say bovine pyelonephritis, and who are the main troublemakers behind it?
Right. So at its core, it's an inflammation of the renal pelvis. That's the sort of funnel for urine inside the kidney and the kidney tissue itself, the parenchyma.
Okay.
And the economic hit from this, it's massive. Seriously, we're talking high fatality rates if it's left untreated. Huge drops in milk production, significant weight loss, the sheer expense of long-term antibiotic treatments, and, well, unfortunately, often the necessity of culling the affected animal.
That sounds incredibly costly. And painful for the animals, too.
Yeah.
So what's causing all this trouble? Is it like just one specific bad actor, or is it a more complicated cast of characters?
It's definitely more of an opportunistic ensemble, as you put it. Historically, the Corynebacterium rhinale group that includes C. rhinale, C. pilosum, and C. cystitidis has been seen as the principal cause.
Corynebacterium rhinale.
Yeah, and C. rhinale itself is most often linked to the really severe form. Now, these are gram-positive bacteria, and they produce urease. That's an enzyme that breaks down urea.
Right.
And here's the kicker. They're often part of the normal, completely harmless flora of the lower urogenital tract.
That's fascinating. So a normal inhabitant can suddenly turn into such a major problem.
Precisely.
But I've also heard whispers, maybe more than whispers now, about another major player coming into focus. What's the latest on that?
Absolutely. You're probably thinking of uropathogenic Escherichia coli, or UPEC.
Coli, yeah.
It's increasingly recognized as a primary agent, and it's often directly linked to fecal contamination.
Okay, that makes sense.
And there's even a potential public health angle here. Some studies have identified UPEC serotypes that are potentially zoonotic, meaning they could theoretically pass between animals and humans.
That's definitely something to be aware of.
We also frequently isolate Truparella pyogenes. It used to be called Arcanobacterium pyogenes.
Right, I remember that name change.
Finding it often means it's part of a mixed infection and typically signifies a really severe disease process. And then beyond these main ones, other opportunistic bacteria can jump in various Streptococcus, Staphylococcus, Proteus, Klebsiella, Pseudomonas, even Enterococcus.
So it sounds like quite a crowd can get involved if the conditions are right.
Exactly.
So how do these opportunistic bacteria, go from being just sort of there, either normally or from the environment, to causing such a severe disease? What's their journey inside the animal? How do they manage to set up shop?
Well, the infection almost exclusively follows what we call an ascending pathway.
Ascending, meaning going up.
Exactly. It starts with contamination of the external urethral opening. Then the bacteria colonize the bladder, which leads to an infection there that's cystitis.
Okay, bladder infection first.
Right. From there, the bacteria climb upwards They travel via the ureters, those tubes connecting the kidneys to the bladder, up to the renal pelvis, that funnel we mentioned. And finally, they invade the actual kidney tissue, the parenchyma.
Wow. So they really work their way up.
Hmm.
What helps them do that? How do they stick around?
That's where virulence factors come in. These are like the bacteria's special tools.
Shit.
Especially tiny hair-like structures called pili, or fimbriae, found on C. renale and E. coli.
Pili, fimbria.
Okay.
Think of them as microscopic grappling hooks.
Right. They allow the bacteria to firmly latch onto the urothelial lining, the inside surface of the urinary tract. This prevents them from just being flushed away by the flow of urine.
Clever. In a nasty sort of way.
Isn't it? And specifically for C. renale, it also produces that urease enzyme we talked about.
The one that breaks down urea.
Exactly. It breaks urea down into ammonia. Now, this ammonia irritates the urinary lining itself, and it also makes the urine more alkaline, creating a more favorable environment for the bacteria to grow.
So it actually changes the environment to suit itself better.
Precisely. And crucially, any conditions that mess with normal urine flow or compromise that valve-like junction between the ureter and bladder.
The ureterovesical junction.
That's the one. It normally prevents urine from flowing backwards from the bladder up towards the kidneys. If that's compromised, it makes it much, much easier for bacteria to ascend.
Okay, so anything blocking flow or allowing backflow is a problem.
The big problem. And once these bacteria establish themselves up in the kidneys, the host's own inflammatory response kicks in trying to fight them. But this response itself leads to tissue damage, necrosis, tissue death, and eventually the formation of painful abscesses.
Oof. That sounds like a real battleground inside the kidney.
It really is.
So that leads to the next question, doesn't it? What makes certain cattle more susceptible? Why can't their bodies just fight these bacteria off or, keep them out in the first place?
That's a key point. The transition to actual clinical pyelonephritis is almost always triggered because the host's defenses are somehow compromised.
Okay.
And here's a really powerful insight, especially for dairy producers. The period right around calving, the periparturient period, that is the time of greatest risk for adult dairy cows.
The time around giving birth.
Exactly. Think about this statistic. A staggering 75% of these severe kidney infections are actually a direct follow-up, a consequence of complications right after a cow gives birth.
75%. Wow. Like what kind of complications?
Things like dystocia, that's a difficult birth, or abortion, retained fetal membranes where the afterbirth doesn't pass normally, or metritis, which is an infection of the uterus itself.
Right, great.
All these events cause physical trauma and contamination, basically opening the door for infection to get started and travel upwards.
So it's often linked back to problems during or just after calving?
Directly linked. It's a massive aha moment for prevention, really.
Yeah.
It highlights how pyelonephritis can be a direct consequence of, maybe inadequate transition cow management. If that period isn't managed perfectly, the risk skyrockets.
That's huge. What about other factors? Anything else make them vulnerable?
Yes, definitely. Anatomical and physiological factors play a part too. For instance, the female urethra is shorter and wider than in males, which, naturally offers a less formidable barrier for bacteria to travel.
Makes sense.
And here's a subtle but critical insight about diet. You might think high-protein diets are always good for production, right? They're common in high-producing dairy cows.
Yeah, you push for production.
But those high-protein diets can lead to more alkaline urine. And guess what thrives in that alkaline environment?
Let me guess. The Corynebacterium we talked about earlier.
You got it. It enhances their growth and their ability to adhere, to stick. It's a perfect example of how a seemingly small dietary factor can have a surprisingly big health impact.
That is interesting.
Yeah.
So diet matters too. What about things humans do? Management factors.
Absolutely. Iatrogenic, meaning veterinarian-induced, and management influences are also crucial. For example, non-sterile urinary catheterization is a well-documented risk factor if you introduce bacteria that way.
Big trouble.
Right. Historically, the decline in just routinely catheterizing cows has actually correlated with a decrease in C. renale infections.
Okay, so avoid unnecessary catheterization and be sterile if you must.
Exactly. We also need to consider venereal transmission spread during breeding from asymptomatic carrier bulls. Though thankfully artificial insemination, or AI when done with strict hygiene, effectively eliminates this route.
Good point about AI. Any other risk factors?
A couple of others worth mentioning briefly. A patent urachus, that's an unclosed connection from the bladder to the umbilical cord in newborn calves, can be a route for infection. And urinary tract obstruction, like urolithiasis or bladder stones, particularly in male animals, can predispose them by blocking urine flow.
Okay, so a lot of potential triggers. Now, once an animal is affected, what does it actually look like? Are the signs always really obvious, or can they be subtle, making it harder to spot early on?
Yeah, the clinical signs can vary quite a bit. With the acute form, acute pyelonephritis, you'll often see a pretty sudden onset. Systemic signs, like a noticeable, often high fever, maybe 103.5 to 105.5 Fahrenheit,
High fever, okay.
anorexia, loss of appetite, depression, just looking miserable, and often a really sharp, precipitous drop in milk production. That's a big flag.
Milk drop, yeah. Always a sign something's wrong. What about urinary signs specifically?
You'll see signs pointing to the urinary tract. Pain and colic, the cow might be restless, kicking at her abdomen, swishing her tail a lot, treading with her hind limbs.
Signs of discomfort.
Definitely. There's also stranguria, that's painful straining when trying to urinate. Polyuria, meaning frequent urination, maybe small amounts, often. And then obvious abnormalities in the urine itself.
Like what?
It might look reddish-brown because of blood hematuria, or cloudy because of pus pyuria. You might even see strands of fibrin or blood clots, sometimes especially noticeable in the very final stream of urine.
Ugh, sounds awful for the poor animal.
It really is. Now, in contrast, you have chronic pyelonephritis. This develops much more slowly, insidiously over weeks or even months.
So it's harder to spot, maybe.
Often, yes. The signs here are frequently more subtle and nonspecific. Things like progressive weight loss, just not keeping condition, poor body condition overall, variable appetite, maybe off feed one day, okay, the next. And chronically reduced milk yield, not that sudden drop, but just lower than expected over time.
Okay, more of a gradual decline.
Exactly. Fever might be intermittent, coming and going, or even absent altogether. And the urinary abnormalities can be less pronounced than in the acute form. Anemia is also common in these long-standing cases, just from chronic inflammation and maybe blood loss.
And what about really severe cases?
In severe advanced cases, you might see signs of uremia, that's the buildup of waste products in the blood because the kidneys are failing. This could show up as things like oral ulcerations or even an ammonia smell on the breath.
Okay, so quite a range from sudden and dramatic to slow and subtle. Given these varied signs, how do veterinarians actually pin down the diagnosis? How do they go from these clues to saying, yes, this is definitely pyelonephritis? It sounds like playing detective, doesn't it?
It really is. It involves a systematic diagnostic approach. First off, the physical examination, particularly doing a rectal palpation, is critical in cattle.
Right. The vet goes in. What are they feeling for?
They're checking the urinary tract components they can reach. The lift kidney, which is normally mobile in cattle, might feel enlarged, maybe firm and painful when palpated. It might lose its normal lobulated feel.
Losing the kidney shape?
Kind of, yeah. The distinct lobes might feel smoothed out or distorted. The ureter, the tube draining that kidney, might also feel thickened and possibly distended, like a firm cord. The bladder wall itself could feel thickened and sensitive.
And the right kidney.
The right kidney is further forward and higher up, so it's not normally palpable rectally in adult cattle, so you're mainly assessing the left side that way.
Okay, so rectal exam gives clues. What's next?
Urinalysis. This is really the cornerstone of diagnosis. You need to get a urine sample.
How do they usually collect that?
Sometimes you can catch a voided sample, especially if they're urinating frequently. Other times, catheterization might be needed, but remembering that risk factor, it has to be done aseptically. Or sometimes stimulating urination works.
Gotcha. And once you have the urine,
You look at it grossly first. Inspect it for abnormal color, that reddish-brown or cloudiness we mentioned. Look for flocculent material, little clumps, pus, fibrin, blood clots.
just looking tells you something.
It does. Then chemical analysis using urine dipsticks. These will consistently show positive results for protein and blood, often for leukocytes, white blood cells too. And the urine pH might be alkaline, especially if those urease-producing bacteria like Corynebacterium are involved.
Okay, dipsticks give more clues.
Yeah.
But how do you confirm infection?
That comes from looking at the urine sediment under a microscope. This provides definitive evidence of inflammation and infection. You'll see large numbers of white blood cells, that's the pyuria, red blood cells, hematuria, and crucially, bacteriuria. Seeing all those together is highly suggestive.
Microscope confirms the inflammation in bugs. Is that the final step?
Almost. The gold standard really is urine culture and antimicrobial susceptibility testing.
Throwing the bacteria and seeing what kills them?
Exactly. This is essential for identifying the specific pathogen. Is it C. renae? Is it E. coli? Is it something else? And, critically, guiding effective antibiotic therapy. This is especially important now with the rising prevalence of multi-drug resistant organisms, particularly E. coli. You need to know which drug will actually work.
Makes total sense. Any other tools? What about imaging?
Yes, diagnostic imaging, specifically ultrasonography, can be a really valuable, non-invasive tool.
Ultrasound of the kidneys.
Yes. The vet can use ultrasound over the flank or sometimes rectally. Findings might include dilation, widening of the renal pelvis and the ureters. You might see cystic lesions within the kidney tissue itself, or accumulation of echogenic debris, basically. Bright stuff on the ultrasound, which could be pus or inflammatory material.
So ultrasound can visualize the damage.
Yeah.
And blood work.
Blood work is important too. Checking blood urea, nitrogen, BUN, and creatinine levels tells you about kidney function. If these are elevated, it indicates significant renal damage has already occurred.
Okay, so it's a combination. Physical exam, urinalysis, culture, maybe ultrasound, and blood work to get the full picture.
Precisely, a systematic approach.
Now, this leads me to wonder, what if it's not pyelonephritis? You mentioned similar signs sometimes. How do veterinarians differentiate it from other conditions that might also cause things like blood in the urine or painful urination? It sounds like a diagnostic puzzle where one wrong turn could have serious consequences for treatment.
You're absolutely right. A thorough diagnostic workup is crucial because those clinical signs can definitely overlap. Take, for example, uncomplicated cystitis.
Just a bladder infection, right?
Exactly. Inflammation confined just to the bladder. Unlike pyelonephritis, it typically presents with no systemic signs like that high fever. On rectal palpation, the kidneys and ureters would feel normal, but the bladder wall might feel thickened.
And the urinalysis.
Urinalysis would show inflammation, pus, blood, bacteria in the urine, but usually only minimal protein unless there's significant bleeding directly from the bladder wall. You wouldn't see the really high protein levels you often get with kidney damage.
Okay, so location and systemic signs are key differences there. What else looks similar?
Well, there's urolithiasis, urinary stones. This primarily affects male cattle, steers, or bulls.
Stones, okay. How does that look different?
The hallmark is urethral obstruction. The animal often can't urinate at all or just strains painfully and dribbles urine. They show severe colic, real distress. On rectal palpation, you'd feel a very distended, tight, turgid bladder because the human can't get out.
So blockage is the main sign.
Yes. And urinalysis, if you can even get a sample, would likely show blood and crystals, the components of the stones.
Got it. Any other mimics?
Renal amyloidosis is another one. This is a chronic, non-infectious disease seen more in older cattle, often those with a history of some other chronic inflammation somewhere in the body.
Amyloidosis. What are the signs there?
It presents quite differently systemically. Insidious weight loss, chronic diarrhea often, and pronounced ventral edema, swelling under the jaw, bottle jaw or brisket, because they lose so much protein from their blood.
Okay, swelling and diarrhea sound different. What about the urine?
Urinalysis is the absolute key here. You see massive protein in the urine, huge amounts, but with minimal to no pus, blood, or bacteria. That pattern, massive protein, quiet sediment, points away from infection and towards amyloidosis. The kidneys might feel enlarged on palpation, but usually non-painful, and they keep their normal lobulated shape.
Very different urine picture. One more.
Bracken fern toxicity, sometimes called enzootic hematuria. This results from chronic ingestion of bracken fern over a long period.
Eating the wrong plant.
Exactly. The primary sign is persistent blood in the urine hematuria because the toxins cause tumors or growths in the bladder wall. Systemic signs, if any, are usually related to chronic blood loss, like anemia.
So mainly blood in the urine.
Yes. And the urinalysis reflects that. Lots of red blood cells, but typically minimal pus and no significant bacteria because it's not primarily an infection.
Okay, so connecting this all back, it really is a diagnostic puzzle. Combining that detailed history, the hands-on physical exam, and those specific lab tests, especially urinalysis and culture, is absolutely vital to sort through these possibilities and arrive at the correct diagnosis.
Couldn't have said it better myself. It requires careful detective work.
That's a lot to untangle. So let's say the vet has done that work. They've definitively diagnosed pyelonephritis, solved that part of the puzzle. What's a game plan for treatment then?
Right. The cornerstone of treatment is a prolonged course of appropriate antibiotics. And I mean prolonged, typically 3 to 4 weeks.
3 to 4 weeks. That's a long time for antibiotics in a production animal.
It is. Sometimes the recommendation is even to continue treatment for at least 2 days after all clinical signs have completely resolved, just to be sure. And drug selection should ideally, really ideally, be based on that urine culture and sensitivity testing we talked about.
Because of resistance.
Exactly. Especially with E. coli becoming more resistant, you need to know what's actually going to work. You can't just guess.
So for a farmer or veterinarian listening, what are the key types of antimicrobials they might be looking at, assuming they have the sensitivity results or need to make an educated guess initially?
Okay. For the Corynebacterium or nail group, traditionally, specific types of penicillin, like procaine penicillin G, have been the treatment of choice. Given intramuscularly at the right dose, often twice a day, or maybe a higher dose once a day.
Penicillin for Corynebacterium. What about E. coli?
For E. coli, you generally need broader spectrum coverage. Third-generation cephalosporins, like Ceftiofur, are often a good choice. They provide excellent coverage and penetrate the urinary tract well.
Ceftiofur. Okay, any other options?
Yes, depending on sensitivity results, other options might include ampicillin, amoxicillin, or maybe trimethoprim sulfonamide combinations. But again, culture is key. And it's really important to note that aminoglycosides drugs like gentamicin are generally considered unsuitable for food animals.
Why is that?
Two main reasons. They can be nephrotoxic, meaning damaging to the kidneys themselves, which is the last thing you want in a pyelonephritis case. And they have very long withdrawal periods for meat and milk, making them economically impractical.
Gotcha. Avoid aminoglycosides.
Generally, yes. And what's perhaps fascinating isn't the right word, but what's a major consideration here is that this requirement for such long-term therapy presents a significant challenge in production medicine.
How so?
Well, think about the economic pressures. Weeks of treatment mean weeks of discarding milk, which is a huge loss for a dairy farmer, and extended meat withdrawal times if the animal is intended for beef. It's not just the cost of the medicine, it's the lost production that really hurts.
That's a really great point. It highlights the practical difficulties. Now, beyond the antibiotics, what other supportive care is critical to help these animals pull through, especially the severe cases?
Right, antibiotics are key, but often not enough on their own. For severe cases, especially if they're dehydrated or showing signs of uremia, intravenous fluid therapy is essential.
IV fluids. Why?
Several reasons. To correct dehydration, obviously. To help fix electrolyte and acid-base imbalances that often occur with kidney disease. And importantly, to promote diuresis, increased urine production, which helps flush bacteria and inflammatory debris out of the urinary system.
Flushing the system. Makes sense. Anything else?
Non-steroidal anti-inflammatory drugs, NSAIDs, can be very beneficial. Drugs like flunixin or ketoprofen, they help reduce the fever, alleviate pain, remember the colic signs, and reduce the inflammation within the kidney and urinary tract, making the animal feel better and potentially limiting further damage.
Okay, fluids and pain relief. Is surgery ever an option for such a deep-seated infection, or is it always purely medical management?
Surgery can be an option, yes, but it's typically reserved for valuable animals, and usually only when the disease is unilateral, affecting only one kidney, and severe or refractory, meaning it's not responding well to medical treatment.
What kind of surgery?
Specifically, if there's extensive abscess formation or hydronephrosis, that's severe swelling of the kidney due to urine backup surgical removal of the affected kidney, which is called a nephrectomy, can be the treatment of choice.
Removing the whole kidney.
The affected one, yes. But, and this is a huge but, this is only considered if the other kidney is healthy and functioning adequately to support the animal on its own.
How do they know if the other kidney is okay?
That's where those blood tests for kidney function, like serum creatinine, become critical before surgery. If creatinine is already significantly elevated, it suggests both kidneys are compromised, and removing one would likely be fatal. So you have to assess the contralateral kidney function first.
Okay, so nephrectomy is a possibility, but only in specific, carefully selected cases.
Exactly. It's not a routine procedure for pyelonephritis.
So, taking all this treatment information together, the long antibiotics, the supportive care, maybe surgery, what does this all mean for the animal's chances of recovery? What's the prognosis actually like after going through all this? Is it good, bad, somewhere in between?
Honestly, the prognosis is generally considered guarded to poor.
Guarded to poor, that doesn't sound great.
It's often not. It's highly dependent on several factors. How much of the kidney tissue is actually involved and damaged, how long the infection has been going on before treatment starts, and of course, how well the individual animal responds to the chosen therapy.
Are there specific indicators that suggest a better or worse outcome?
Yes. Those blood markers we mentioned, BUN, and especially creatinine concentrations, are key prognostic indicators. If these are significantly elevated at the time of diagnosis, particularly creatinine levels rising above a certain threshold, say around 1.5 milli-GADL, it's associated with a very grave prognosis.
How grave?
Well, one study found that cows with elevated creatinine had a shocking 104 times higher odds of being culled compared to those without.
104 times.
Oh.
Wow. That really underscores the importance of kidney function.
Absolutely. It tells you how much irreversible damage has likely already occurred.
So does catching it early help?
Definitely. Timely intervention significantly improves the potential outcome. Chronic cases, or cases where both kidneys are clearly affected, bilateral disease, naturally have a poorer prognosis. If it's caught relatively early and seems to be primarily unilateral, affecting just one kidney, there's a better chance of recovery with aggressive treatment.
But even with recovery, is it always permanent?
Unfortunately, no. Relapse is a significant concern. It occurs in nearly 10% of animals that seem to have recovered completely after treatment.
10% relapse.
Yeah. And this really emphasizes why completing that full, prolonged course of antibiotic therapy is so incredibly critical, even if the animal starts looking and feeling much better after a week or two. Stopping treatment too soon is asking for trouble, asking for a relapse that might be even harder to treat.
That makes sense. Don't stop the meds early.
Absolutely not.
Okay, so given the significant challenges of treatment, the cost, the long duration, the withdrawal times, and this guarded to poor prognosis, especially for advanced cases, what's the most effective strategy overall for managing bovine pyelonephritis on a farm?
Prevention. Without a doubt. It is truly the most effective and ultimately the most economical strategy.
Prevention is better than cure, especially here, it sounds like.
Absolutely. And it requires a multifactorial approach. You have to focus on minimizing all those risk factors we talked about, the host factors, the environmental factors, and the management factors.
And linking back to what you said earlier, that connection to calving problems seems huge.
It's paramount. We highlighted that really strong association between pyelonephritis and those postpartum complications, dystocia, retained placenta, metritis. This means that preventative efforts for pyelonephritis are inextricably linked to having robust, effective transition cow management programs.
So managing that vulnerable post-calving period well is key.
It's probably the single most important thing. If you manage that transition period successfully, minimizing those uterine issues and stress, you're already leaps and bounds ahead in preventing this disease from ever taking hold.
Okay, let's break this down then. For farmers and veterinarians listening, what are the key practical strategies for prevention they should be focusing on day to day?
Right. First and foremost, hygienic management, especially around calving. Providing a clean, dry, well-bedded maternity area is crucial. This dramatically reduces the bacterial load that cow and calf are exposed to during and immediately after parturition.
Clean calving pens.
Basic, but vital. Absolutely vital. And coupled with that is prompt and effective management of any postpartum uterine diseases that do occur. If a cow retains her placenta or develops metritis, dealing with it properly and quickly is crucial to stop it from potentially progressing to pyelonephritis later. Don't let those uterine issues linger.
Okay, hygiene and quick treatment of postpartum issues. What else?
Then there are breeding practices. As we mentioned, the widespread use of artificial insemination, or AI, when performed using strict hygienic protocols, effectively eliminates the risk of venereal transmission of Cwanell from carrier bulls. That was a historical concern that good AI practice largely solves.
So good AI technique helps prevent kidney infections too. Interesting link.
It is. Next, consider veterinary procedures in general husbandry. We already touched on the judicious and critically aseptic use of urinary catheterization, basically. Avoid it unless necessary, and be sterile if you do it.
Right.
Nutritional management is also part of prevention. This involves formulating balanced rations to avoid that excessive dietary protein that can increase urinary pH and favor Corynebacterium.
The diet link again.
Exactly. And also carefully managing transition diets to help prevent metabolic diseases like hypocalcemia or milk fever, which can weaken the cow's overall immune system and make her more susceptible to infections in general. And one more simple thing. Ensuring constant access to clean, fresh water.
Water. How does that help prevent pyelonephritis?
It encourages regular urination. Good water intake leads to good urine output, which helps physically flush bacteria out of the urinary tract before they can establish themselves and ascend. Simple but effective.
Makes sense. Flush the cyst naturally. What about managing infected animals?
That falls under biosecurity and herd health. It's really important to isolate animals that are diagnosed with pyelonephritis. This helps minimize environmental contamination with the bacteria they're shedding in their urine.
Keep them separate.
Yes. And though it's a tough decision, you should seriously consider culling chronically infected animals. They can act as persistent carriers, continuing to shed bacteria and pose a risk to other animals in the herd, even if they look relatively okay sometimes.
Culling chronic carriers, that's a hard call, but sometimes necessary for the herd.
It often is. And finally, just practicing standard biosecurity protocols for any new animals being introduced into the herd is always important to prevent bringing in new strains of bacteria or other diseases.
Okay, so it's a combination of clean calving, good postpartum care, careful procedures, smart nutrition, water access, and managing infected animals.
Exactly. It's a holistic approach.
Wow, we've truly taken a deep dive today, haven't we, into bovine pyelonephritis. From really understanding those opportunistic bacterial culprits like Corynebacterium rhinale and increasingly E. coli, to recognizing the critical role of factors like those postpartum complications, which is a huge point, and even things like diet in its development.
Yeah, those links are key.
We've seen how nailing the diagnosis relies on that combination of careful observation, the physical exam, especially rectal palpation, and those crucial lab tests like urinalysis and culture.
Getting the evidence.
Exactly. And how treatment, although it's definitely challenging with the long duration and guarded prognosis, does offer a path to recovery for some animals, particularly if caught early.
Yes, treatment is possible, but prevention is really where the focus should be.
Absolutely. And if we connect this to the bigger picture, like you've been saying, this isn't just about a kidney infection in isolation, is it?
Not at all. It's really a powerful reminder of how interconnected animal health is with everything else on the farm, overall management, hygiene standards, nutrition strategies, especially during those really vulnerable periods for the animal, like that postpartum phase.
Yeah.
And the hidden costs, the lost milk, the treatment expense, the potential culling, and the sheer challenges of treating severe cases really hammer home why prevention is ultimately the goal. It's often the most humane and the most economically sound strategy in the long run.
So what's your takeaway from all this as someone listening, wanting to be well-informed about animal health?
Well, I think this raises an important question, something to ponder. Considering the significant economic impact of diseases like pyelonephritis and seeing how strongly they're linked to these broader management factors, what seemingly small or perhaps overlooked aspects of day-to-day animal husbandry might actually have the largest sort of ripple effect impact when it comes to preventing widespread health issues and ensuring productivity in an agricultural setting, where are those leverage points we might be missing?
That's a great question to leave people with. What small things have big impacts? Think about that. Until next time, keep digging deeper into the knowledge that matters.